Hello, everyone. It's Joyelle here from Parenting with PTSD, and I'm here today with Lara Donachie. We're going to have a discussion about getting ready for your next medical appointment. And medical appointments is something that can be very triggering and challenging for trauma survivors. So we're going to talk about how to make things a little bit easier for yourself. Lara is a contributor to our book, Parenting with PTSD. She is a single mother of twins, and she has been a registered nurse for more than 20 years and a certified educator for more than 7 years. She's also one of the moderators of our Facebook group for Parenting with PTSD. And she is going to be taking a trauma recovery coaching program very soon, and I'm very excited to see what happens there. And if you want to learn more about Lara, you can see her website at Today Not a Minute More, where she writes about being a survivor of childhood and adult sexual trauma and how she has been in sobriety from alcohol for more than 12 years. So thank you, Lara, for being here today to talk with us.
Thanks for having me again.
So I'm really excited to talk with you about this because I think that your history of being both a survivor yourself and also working within the medical system makes you the perfect person to talk about how we can advocate for ourselves when we are in our next medical appointment. So before we get into that, let's talk about what kind of things can commonly come up for survivors that are triggering and make them feel unsafe within a medical environment.
Well, I think that number one, the biggest thing is feeling unheard. I think that for a lot of survivors, they go into a medical appointment, or anybody goes into a medical appointment and they feel unheard. And for a survivor, I think it can be really triggering because in many situations they already are feeling unheard in their lives, and it just brings it to a whole new level. It's just another area of their life that not being heard, they don't feel believed, they don't, they don't feel like they have control, and so it just escalates it automatically. Again, that overarching feeling of being out of control is very prevalent in the medical community. A fear of being judged. It's frequently, we walk into an appointment and we have a long list of things, we feel judged about having them, and it just goes along with that. Fear of being triggered by being touched or having procedures, and especially like with GYN visits, and also with dental visits. I find that dental visits are probably number one on the list, and GYN visits are number two for survivors. And then I guess the other thing is just the feeling of being afraid of sharing, and what do you have to share and what don't you have to share, and that vulnerability and taking the mask off are probably the things that come to mind for me. Do you have anything to add to that?
I think that's a perfect roundup, especially what you were mentioning about how dental visits and gynecological visits can be the most triggering. I think there's an aspect of vulnerability that is what makes those appointments in particular so stressful and challenging for people.
Yeah. And, we tend to have a long list because, and we'll talk about this, I think, a little bit later, but we tend to have a long list because we tend to have a lot of stuff going on as a result of our trauma history. And so it sets us up in kind of a way that we have a long list of medical issues, but we're afraid to have them dealt with. And so it's like a catch-22.
Right. So let's talk about getting prepared in advance of your appointment and what you can do, how you can advocate for yourself, how you can prepare yourself.
So the first thing is you can, when you make the appointment, you can ask if they're a trauma-informed facility. You can ask if the staff has gone through training for that. These are questions that they should have answers for. And the other questions you can ask if they don't have the answer for that is, do they have an experience working with patients who have a history of PTSD or with significant anxiety? Those are other words that they may feel more comfortable answering if they don't understand the concept of being trauma informed. and you can ask, especially with dentists, if they have experience working with patients who have significant anxiety. They'll know automatically about that. Do the research. Sometimes there's information online about providers' experience with things. Even if you look it up on like insurance or look it up on, many websites, if you look it up, you'll see if there's information about providers' specific experience with things, or you'll see other patients' experiences with the provider, and then ask around to other people as to what their experience has been with that provider. I think, those are great things just to kind of get yourself in a position of what you're walking into. You're always going to have your own experience, but kind of having a sense of, this is somebody that I trust, I kind of know them, and this is what their experience was.
Mm-hmm.
I would write down what you want to tell the provider about your trauma history, if anything. And then also what issues that you want to address. Having it written down takes kind of some of the pressure off, and you don't have to try and remember everything. And
Mm-hmm.
you can kind of, really talk it out with somebody, or, have it all mulled out ahead of time. And that way, you're not sitting on the edge of your seat the entire time trying to make sure you get every little last piece in, and not forget anything.
Yeah.
And then have a list of grounding techniques with you that typically work for you in stressful situations, whether it's breathing or counting objects in a room. For me, square breathing, and I usually, do the square on my leg. There's all kinds of techniques that different people use when they get in stressful situations. But having those written down, again, makes it so you don't have to remember in the moment. Because I know for me, when I get triggered, remembering in the moment is a really hard thing.
Yes, absolutely.
And then one other thing is you can sometimes in some providers' offices make a preliminary appointment, like a meet and greet, and to see if you're comfortable with a provider before actually like deciding to see them.
Right.
And so you don't always have to commit to seeing them and actually going through with an exam first. And so that's sometimes an option in certain offices with certain, depending upon where you live.
I was just thinking about one thing that you mentioned, which is having a sort of a list of grounding techniques in advance. And I'm just going to put up Pete Walker's website on the screen here so people can see it.
Yep.
Because on his website, he has a list of 13 steps for flashback management.
Mm-hmm. I've seen that, yeah.
And I think that if people aren't sure about what grounding techniques they might use, this could be a good idea to kind of read through and just maybe pick some of those and see if they work for you. Because not everybody has that list prepared quite yet. So, and I think it's really important and it's very personal to you what works. And I like how you were talking about, counting things in a room. That's something that I know a lot of people use to help ground themselves in the present moment, or different physical sensations, like things you can do with your fingers and wiggling your toes, just kind of helping you ground in this moment. And that can be really helpful.
So those are things I would do ahead of time. Do you have anything to add with that?
And I would say, especially with dental appointments, because there is an option to take medications for anxiety. So that's something I would say, like, research into, see if that feels right for you. Make sure you know in advance what you're going to need there, because most of the time, if you're taking a medication for anxiety, you will need somebody to transport you to and from the appointment. You won't be able to drive. So that'll just be an extra layer of arrangement that you'll have to make.
Yeah, and that's one of the things I brought up during the appointment, is that you may want to have somebody come with you to the appointment. So you can prepare that before, but also for during and after. So for during the appointment, having somebody with you for support and for advocacy, if needed, and then also just as a second set of ears, because when I get overwhelmed, sometimes I miss half the information of what's being told. And so having somebody as a second set of ears that can just be writing down, what the provider is saying, so that, again, that just brings my anxiety down a little bit, that I don't have to take in absolutely everything because somebody else is also taking in some of it for me. And so I said for during the appointment, you can give yourself permission in most situations to stop the appointment at any point. So for me, having that permission that I've given myself to say, you know what, I'm from the beginning, I can walk out at any point. I can just say, okay, I'm done here. Obviously, if you're in the middle of a dental procedure, or if you're in the middle of a certain procedure, you may have to wait for them to, finish things up enough so that you can leave. But, I have enough control over the appointment to say, I can't finish this and I'm going to be done now. And just reminding myself of that is very helpful, and just is empowering, and gives me back some control. Again, I said bringing somebody with you, and then letting the provider know, even if you're deciding not to share about your trauma history, but letting them know that these types of appointments make me very anxious, and so I may need to do some breathing or fill in the blank of whatever it is, in order so that I can get through this appointment, and just let them know so that, in the middle of having a dental exam or a pelvic exam or whatever it is, you're not saying, hold on, I need to stop and breathe. But if you tell them ahead of time, it doesn't feel so abrupt. And so, for them also, it feels more fluid if you're letting everybody in the room know. Again, use that list of grounding techniques, have it with you, and have the list of questions and or issues with you. And you always have the right to ask for a female staff member to be present during an exam if it's not done automatically. So if you're seeing a male physician and they're doing any kind of, or you're seeing a male dentist and you're having dental work done, you always have the right to ask for another staff member to be present in the room if you're not comfortable. So those were the big things that I had.
Yeah, and I think the important thing to remember is what you were saying earlier, is that you're in control of the situation. So you're in control of how much information you divulge. And if you decide that you want to divulge your trauma history and you feel safe in this environment, then you can. If you don't, then it's perfectly fine to say, no, these kinds of appointments make me feel really anxious. So here's what I need. You are under no obligation to disclose your trauma history in an environment where you don't feel comfortable doing that. And also in that moment when you need a break, it's always fine to say, I just need to use the bathroom.
Right.
Which is a great escape to give yourself a few minutes to calm down, use some breathing techniques, and then see if you feel ready to go back in and finish the appointment or not. And that can give you a little bit of a, that's your first step, right? If you're feeling anxious and things are starting to really rise up inside of your body, maybe have some body memories happening or something, you can give yourself a few minutes to go get away to the bathroom, take some time, and then reevaluate. Okay, where am I at? Can I go back in, or do I need to just say stop here? And that's perfectly valid. And it's okay to take that for yourself and to take that control of the situation.
Yeah. And then for after, I really want to stress just to be gentle with yourself. Try not to schedule anything after the appointment, so that you can kind of regroup. Again, it's good to have somebody with you so that they can drive you home, like you said, in the case that you took anything, but also just because, you might be feeling really fragile. You may have had some flashbacks. You may have had some body memories. And it's just a safer choice to have somebody drive you home in those situations. Don't ask too much of yourself for the rest of the day, or at least for a few hours, and practice good self-care. Debrief with somebody that you trust when you're ready, whether it be a therapist, a good friend, a family member, about the appointment, what worked for you, what didn't work for you, and then make changes as needed, whether it be next time, I need to do X, Y, and Z, or I need to add in this, or I really need to practice some of those grounding techniques and find some more that work for me for the next time I go into an appointment. If the provider was really compassionate and respectful, let him or her know that. Give them the positive feedback, because they're going to respond to it. No different than a child will respond to positive feedback. Other adults do too. And they're gonna respond and behave that way. If the provider was not helpful, or you felt they were hurtful to the situation, you can evaluate your choices. Some people have more choices than others, depending upon where they live, and what their insurance situation is or their healthcare situation is. Evaluate, is this provider going to continue to work for me or not? Do I have a choice of a different provider? Again, those are different questions that are going to be different depending upon where you live and what your healthcare situation is. But really just being gentle with yourself and giving yourself time to debrief about all of that, I think is really important.
Mm-hmm. And it occurred to me that we should just define, for people who may not be familiar with the terms, the difference between a flashback and a body memory. And these are things that can both be triggered during a medical appointment.
Yeah. So a flashback is when you're actually taken back to, usually as a visual in your head experience. Usually it's a memory that you've had, or experience you've had of a trauma event. Whereas a body memory is when you're physically feeling the feelings of a traumatic event in your body, that sometimes what event is related to, and sometimes you don't. But you aren't necessarily having a flashback connected to, you're not necessarily having the visual connected to the body memory. So,
right. So typically with a body memory, you would have an emotional reaction to physical sensations, and that can be extremely disconcerting for people who don't understand what's happening to them, because they're suddenly crying and there's right. No mental memory to go with it. And that's just a factor of what happens to our brains during trauma.
Right. And really just being gentle with yourself. If you're having an emotional reaction, there's a reason why you're having an emotional reaction, even if you can't connect it exactly to something. Just be respectful of it and be gentle with yourself around it. And that's a hard thing to learn to do, because I know for me, it historically was, oh my God, why am I doing this? Just stop it. Is what I wanted it to do.
Inner judgment that comes up around these reactions. And as you said, there's always a reason for the reaction, even if we can't mentally understand it in the moment. And to respect that and to be gentle with ourselves is so important.
The other thing I thought was important was for us to define what trauma-informed care is, since we were bringing that up. I did a little search to see if I could find a definition that I really liked. And I found one on the Psychology Today website. It was written in an article called Trauma-Informed Care and Why It Matters. And the definition was trauma-informed care means treating a whole person, taking into account past trauma and the resulting coping mechanisms when attempting to understand behaviors and treat the patient. Mm-hmm. And the only thing I would add to that is that also including any current day stressors and traumas also. So it's not just about the past, it's also about what's happening in the present.
Right.
So there's been a huge push to, in the country, in the world, to do more trauma-informed care and to teach providers and to teach offices about trauma-informed care and how to be more respectful and compassionate and understanding about why we behave the way we do and react the way we do, and where it might be coming from, and how to look at us as a whole person with that, as opposed to looking at it as a whole separate issue. And that came about mostly from the ACE studies. And seeing that how much past trauma is impacting us medically and our current day situations.
Yes, and those who aren't familiar with the ACE study, what it found, the main finding was that there is a direct relation between the number of kinds of childhood trauma you experienced and negative medical outcomes later in your life. So if you're not familiar with that, and you want to learn more about that, I've just put up the website ACEs Too High. You can go check them out and learn a bit more about the ACE study and what its findings were and how it might relate to you in your personal trauma and medical history.
Yeah, and that's the only other thing that I think maybe should be brought up is the pros and cons of disclosing trauma. I think we had talked about that, and it's definitely an individual thing, and it definitely is based on comfort level, and definitely for me has been dependent upon which provider I'm dealing with and the importance of it. But I think, now that we have all this information from the ACE studies and the studies that have come since then, we now have the information that, so much chronic health conditions are coming from childhood trauma and neglect and abuse, not just sexual, and that we are at higher risk of chronic health conditions, and not just mental health conditions. So we're talking about things like heart disease and diabetes and obesity, and then we're also talking about things like alcoholism and drug addiction and smoking, and so there's a whole long list of them. This information can help, if our providers are becoming more trauma informed, this information of knowing what our risk factors are can help in how providers make better decisions. That's the hope, is that it'll help them make better decisions, knowing that we're at risk because of our history. So it's no different than, it's different in the sense that it's sensitive information and it's vulnerable, but it's no different. It's for them as a piece of information than saying my grandmother has a history of heart disease, or my grandmother has a history of high cholesterol, which puts me in a much higher risk group of also having a history of heart disease and high cholesterol. And it also gives them the chance to understand the why behind some of our conditions, lifestyle, and choices. So we want them to be trauma informed, but they can't practice being trauma informed if they don't know we have a trauma history. So they're just going to treat us like any other patient if they don't know that they need to be trauma informed with us. Yeah. And also it helps build a team for us in the case of a crisis. And so, if there's a crisis, there can be a give and take of general information if we give permission between our team, if we have a therapist, if we have a psychiatrist, if we have more than one specialist, they can converse amongst themselves and decide what the best course of action is for us, if they have that information. And also it just, if you end up having a provider that you have a good relationship with, it's just another place that you can share openly, as opposed to it just being another place that you feel like you have to keep secrets. But there's the con side too, that not all medical professionals are trauma informed. Not all medical providers can separate reactions related to being triggered from other mental health conditions. They group them all into one pot. Many survivors are not ready. And sometimes there's safety concerns related to domestic violence, especially when children are involved, which, keep people back from sharing information because they don't want that in their medical record. And so, it's figuring out what's best for you, but just to give the information that there are some pros to it that may not have been thought about.
Yeah, and it's a very personal decision, and everybody has to weigh the cost benefit analysis for them. And I know I've had experiences where I've disclosed my trauma history and that has been helpful. And I have had experiences where I have disclosed my trauma history and it has been hurtful. So I know people who've seen both sides of it, myself included. So whenever you're making these decisions, of course, you have to just rely on your own personal judgment about what is right for you in the moment. And I know that there are a lot of people working very hard to move forward the trauma-informed care movement. Nadine Burke-Harris comes to mind. She's got a fantastic TED Talk about that. But it's going to be a long process, and there are still a lot of people in the system who are not on board with even the basic concept of trauma-informed care. Mm-hmm. So whenever you're making those decisions for yourself, just keep that in mind and just go with what feels right to you in the moment. And then, like you said before, you get to the end of the appointment and you can take a look through what has happened and reevaluate for next time. What would you do differently? How would you advocate for yourself differently? And I think above all, the most important thing that we've talked about today is that when you're in any kind of medical situation, the important thing to remember is that you are in control of that situation. Yep. You can say stop at any point. You can say, give me a break at any point. Yep. And these people are supposed to be serving your health. Yep. And if they're not, and you have other options, then look at maybe finding somebody else to work with if that's an option for you.
Mm-hmm. No, I think that I think gaining our power back in any situation that we can is important, and this is one area that you can. So,
absolutely. And we did not have time to get into it today, but maybe in a future session we can talk more on this topic about medical appointments for our children, because that's a whole other topic in itself.
Yes, definitely.
We're out of time for today, so we will wrap it up. So, Lara, did you have any last thoughts that you wanted to share?
Just like you said, it just be gentle. Everybody be gentle with themselves around this stuff, and it's a trial and error kind of thing. But again, you have control over the appointments, and you don't have to make any decisions. These aren't permanent relationships. If you don't, they don't have to be permanent relationships. It may take a while to change things, but they don't have to be permanent relationships. And you only have to share what you're comfortable sharing. But again, that they're there to serve you. So.
Absolutely.
So thank you again for having me.
My pleasure. So if you'd like to learn more about Lara Donachie, you can visit her website at todaynotaminute.more.com, where she shares resources and writing for other people who are survivors of childhood sexual abuse and who have dealt with CPTSD and addiction as a result of their childhood trauma. And she'll be sharing some more resources over there throughout the next few months. And if you want to find more about what I do, my name is Joyelle Brandt. I am here from Parenting with PTSD, and you can find out more about working with me. Lara and I both do speaking on the topics of adverse childhood experiences and childhood trauma and how that relates to your experiences as a parent. And you can find out more at both of our websites about that. Thanks, everybody, for tuning in today. Remember, always be kind to yourself.